Hello, everyone, and thank you for tuning in to the HPHR Journal Insights podcast. HPHR Journal is an independent academic referred journal that seeks to improve health equity and social justice through the publication of content grounded in thoughtful evaluation of evidence. It is published by the Boston Congress of Public Health, a nonprofit organization that addresses social change at the nexus of public health, health equity, and social justice. This podcast delves into articles published in HPHR Journal that address complex public health issues in an effort to effect social change. My name is Riva Bajuri, and I will be your host. Today, I'm joined by Dr. Colin Truitt, author of Fortification and Expansion of the DACA Program, a Public Health Imperative. His article can be found in HPHR Journal Edition 30 on social justice, available on hphr.org. To start off, please introduce yourself, your professional background, and the content of your research.
Sure. So my name is Colin Truitt. I am a consultation liaison trained, board certified general psychiatrist, currently practicing in Washington, D.C. with a healthcare startup called City Block Health. Throughout my training, during my time as a resident at the University of Virginia and their general psychiatry residency, I was part of our global health leadership tract, and that's been a pretty significant part of my career throughout the last 5 or 6 years or so, having started in medical school, working with Latino populations and specifically working in the Dominican Republic for a time. During residency as part of that leadership track, I also worked in the Charlottesville Free Clinic, Clinica Latina, as well as working with our sort of global education programming revolving around Latin American countries. As a fellow, I worked with the International Rescue Committee, doing some clinic work there, as well as with some specifically immigrant-targeted clinics through Nova Health and the George Washington University psychiatry residency program. So a lot of my interests, both academically and professionally, revolve around health equity, both on the local and global scale. And so that's where I derive my practice now as both a physician and an advocate.
All right, thank you. Definitely very impressive, and we're really glad to have you here on the podcast. My first question is, why did you choose this research topic?
So for me, the motivation is both a professional and a personal matter. Our current healthcare and immigration structures are deeply entrenched in structural racism and neocolonialism. And there's a significant mismatch in American healthcare between racial and cultural makeup of our patients and the appropriate representation among the physicians who serve them. And I think there's an intersection of gatekeeping in both healthcare training and general access to care when it comes to cases such as, DACA that we're discussing today. And so at the time I wrote the article, there was a lot of discussion on how the Biden administration could handle DACA going forward. And at a minimum, maintaining the program provides a much needed but barely sufficient safety net, and so much more could be done. And personally, watching my partner navigate the American immigration system and all of its barriers and frustrations from the relatively privileged position we have, it seemed necessarily to highlight the adversity faced by those forced into a much more vulnerable position, and often unjustly so.
Certainly. Thank you so much for sharing. Could you discuss some of the literature that inspired your research, and if you had any surprising results you found, if you could share that as well?
Yeah, I think it's important to note that, I am first and foremost a clinician, much more than I am a researcher. I'm a healthcare provider, and I believe in the symbiosis of data-driven care and experience-driven data. And so having worked in the settings that I described sort of in my introduction as a trainee, be it from the IRC to Charlottesville Free Clinic, et cetera, I felt that there are populations that certainly everyone deserves our care, but there are issues that we really need to advocate around. And so it wasn't so much the literature, it was sort of what was going on in the general politic, as well as what I was seeing in my clinical experience at the time, that drove me in the direction. And I wanted to see just if what was going on in the research actually reflected the anecdotal experience I was having sort of as a day-to-day clinician, and is just, an active citizen in the US and use my position and my ability to write as a way to bring some attention to it. And so I wasn't really surprised that the amount of literature out there, there is a lot about this particular group when it comes to DACA recipients. And I think it would be a stretch to say that, all of the relatively positive trend lines we see between DACA protection and education attainment, economic contribution, and overall well-being were at all surprising. In fact, I think it's reassuring the consistency across the numerous studies of DACA recipients with these parameters, that when you offer opportunity and legal protection, people thrive and make this country a better, healthier place. And so from taxes to civil service to economic engagement, all the data sort of clearly points in support of immigration and loosening restrictions.
Very interesting. Now, before we kind of get into DACA, I was hoping you could just define it quickly and explain its significance.
Sure. So DACA is essentially an executive order from 2012, whose acronym stands for Deferred Action on Childhood Arrivals. And there's a multitude of factors that resulted in this executive order coming out from the first Obama administration. But it really came under pressure from immigration advocates such as Javier Hernandez, Veronica Gomez, and countless others, for the Obama administration to make good on a lot of their 2008 campaign promises when it came to immigration. And so that administration decided that in response to the failure of the DREAM Act to pass in 2007 to provide a clear path to citizenship for early childhood arrivals. So that refers to people who were minors when they were brought to the United States, perhaps outside their own circumstances. This was sort of seen as the next best course of action. And so, recipients of DACA, though, face a rather specific set of criteria when it comes to, being, quote, sort of young, undocumented immigrants that were in circumstances beyond their control. There are age restrictions from the year the program was instated. And ultimately, recipients must reapply for protections biannually. And one of the most notable aspects of the program is that there is no formal or direct pathway to citizenship even today. This is simply a work and travel permit that allows you to sort of declare yourself in the US and to move freely and seek gainful employment. But really, it's kind of a state of limbo in the current political climate.
Definitely. That's very, very insightful. Thank you. And I can definitely also speak to like the difficulty in navigating the immigration system as a person coming from a family of immigrants myself. But my next question is, what is the main demographic of DACA recipients?
So, DACA recipients, the several 100,000 of them that there are, really represent over 150 different countries. However, greater than 80% of current DACA recipients were born in Mexico. Looking at some of the more recent figures since I wrote the article, the average age of arrival for these individuals was 7 years old to the United States, and a third of them arrived at even younger ages, younger than 5. As of 2021, the average age of the DACA recipient was 26 years old. The amount of initial DACA recipients or applicants, I believe, numbered somewhere around 825,000, and we're now down to current recipients to around 636, 645, depending on the estimates that I was reading. And, these people represent parents to over 250,000 children in this country. So they make up a significant part of our population.
What are some of the obstacles that DACA recipients face specifically in navigating the healthcare system?
So we have to consider the unique barriers that DACA face in a country where so many already struggle with access to healthcare, right? Like this is kind of a theme, particularly in the midst of our ongoing pandemic and even prior to that. when we looked at trying to institute healthcare reform through the Affordable Care Act. So now we're just adding another layer. And what the common denominator really remains expense. DACA recipients face even more limited sets of options when it comes to protecting their health. Over the course of their adult lives, DACA recipients will contribute over $12.3 million to Social Security and Medicare through their taxes. And yet DACA recipients are ineligible for healthcare plans sold on the marketplace under the Affordable Care Act. And due to the way that the Medicaid, Medicare system interacts with the state level, for the most part, DACA recipients are ineligible to receive Medicaid if they find themselves in economic hardship. And so, one study estimated that only about 57% of DACA recipients actually receive employee covered insurance benefits. And, the rest of that is divided between like private insurance that you're financing yourself, higher education plans that we know, are sometimes limited, but do come with education opportunities, such as at a 4-year institution, or simply many are just uninsured. And so, access to care is sort of only one piece as we know, but the immigration experience can also have direct impacts on individual health outcomes and subsequently amplify any limitations already with that access to healthcare. So, from my particular field as a psychiatrist, I'm very concerned about the role of psychological distress and the reciprocal relationship that has with, overall health outcomes. And, we do know that compared to other non-citizen immigrants in the US, that DACA recipients do kind of have improved health outcomes, and at least with regard to psychological distress. But again, it's all on a spectrum, right? So it really does, again, kind of create a sense of limbo in a way. It's not the worst outcome, but things could be significantly better.
Now, in terms of access to healthcare, which you just touched on, I was wondering if you could kind of elaborate on healthcare infrastructure and how this contributes to the specific obstacles that DACA recipients face.
Yeah. So I think the question in this case is almost also part of the answer, right? Like, what is healthcare infrastructure? And I think if we lived in any other country, we may have a different definition of what that is, or perhaps a clearer definition of what that is. Just because, particularly as we experience things in the United States, we do not sort of have a centralized, monolithic healthcare structure. Broadly, we would think of infrastructure as what? The physical, human, and organizational resources that make up the provision of healthcare within a given country or within the US. And the term itself implies a level of organization and cohesion that has some kind of centrality. And in short, it's the basis of public health provision within, our nation. But certainly in the US, we have institutions such as the NIH, the FDA, CDC, OSHA, et cetera, that provide a semblance of framework for minimum health goals and priorities that our nations face. However, unlike most other relatively wealthy countries, there's not an assumption that the state is responsible for providing healthcare to the population as a whole. And so we enter this like tangled nest of local, state, and federal government, intertwined with the inconsistent delivery of care via public institutions or market-driven, private enterprise. And so our system isn't really much of a system to begin with. It's a bunch of individual parts kind of leaning on each other. And when you add in historic socioeconomic and racial gatekeeping through, structural racism with regard to medical education, aka not just the access to care, but the people who provide it, you end up with the strained, near breaking healthcare delivery structures that we now see in the headlines, on a pretty regular basis. And we're having less and less of a supply of physicians and providers to meet those needs.
Very interesting. Thank you. Now, I feel like we have very much established the importance of DACA, and my next question is kind of what are the consequences of potential DACA expiration for recipients?
Yeah. At a minimum, we have to think about this in stages, right? Because nothing ever seems to happen immediately. when there's these status changes. And of course, there's always legal challenges, which leads us back to that sort of the tension of that limbo and distress that we see for individuals in this program. But at a minimum, a default to undocumented status jeopardizes any sense of stability gained through being a DACA recipient. Okay, all of a sudden, income and security of movement are all called into question, and objectively, risk of deportation and the process of repatriation are associated with significant increases in mental health problems, particularly anxiety disorders. And worse, we have years of well-documented evidence of abuses and misconduct against those processed by ICE, and the unlivable conditions of detention facilities related to immigration. And that only further raises just the human rights concerns that would come from a loss of DACA status. But it also, from a practical standpoint, when we think again of just what are we doing to ourselves as a nation of people that really rely on each other, despite representing 18% of the population, including most DACA recipients, Latinx or Latina persons make up only about 5% of physicians, and not that much greater of healthcare providers. And in addition, when we look at it from the flip side, 2/3 of Latinx patients report difficulty adequately communicating or feeling understood by the healthcare workers who are in charge of caring for them. And so even beyond just the ethical concerns, Latinx persons represent one of the fastest growing demographics in our country. And so both morally and practically, this group, among all of our other groups that make up our diverse nation, deserve the adequate representation and care from their providers. And so it would be a perfect storm. And, I'll finally add that even literature coming out of like relatively conservative think tanks like the Cato Institute, also highlighted that it would be a significant economic loss of production for the US should the DACA status be called into question.
So, with all of these considerations in mind, what would be your policy recommendation to try and fix this problem and improve healthcare access for immigrant populations affected by DACA?
I mean, at a minimum, the answer is straightforward. A pathway to citizenship like it is offered under countless other immigration policies. I mean, to hold people in limbo in a program that relies on the political zeitgeist to be maintained. And as we can see, after the recent midterm elections, there's a significant shift in power. There's a power struggle that occurs. And, programs like these are the ones that remain most vulnerable without legislative answers. And so, simply put, I think, as we have evidenced through this article and countless other articles like mine, that immigration only benefits the U.S. and we see it over and over again, from a quality of life of individuals to just economic arguments. And so the fact that we are so rigid and are allowing this program to just kind of remain in perpetual limbo is not just unjust for the people who live it, but for society as a whole that could benefit from expanding our country.
So, as of right now, what is the status of DACA and how has that changed since your article was published?
So, unfortunately, well, let me reframe that. So, fortunately, we still have DACA protection, right? This was one of the first executive actions under the Biden administration to, at a minimum, maintain that individuals could continue to receive the benefits of the DACA program. And as of just checking USCIS, they are still taking applications for renewal, which, as I mentioned earlier, has to be done on a biannual basis. So we at least have maintained the status quo. But, as we saw from Department of Homeland Security versus Regents of the University of California Supreme Court challenge, there is been political will to try to challenge this program and all the protections it affords. And luckily, the Supreme Court knocked that down. and maintained DACA as a program. However, they did not address the merits of the program itself. And so, unfortunately, it doesn't seem like there's been a lot of movement. And as we can see with the current climate regarding the deficit ceiling and everything that's going on, it doesn't seem to be getting a lot of traction. And with the flip of powers in Congress, again, there just seems to be more uncertainty.
So, in terms of kind of the lack of traction, what would your call to action be for the audience, to policymakers, to really anyone to kind of get this back at the forefront of people's minds and enact some sort of change?
I am an advocate for individual physicians, you know, being political and being active and looking at the care they provide as we all take the same oath, right? We all take the Hippocratic oath, and so those of us who practice osteopathic medicine also take the osteopathic oath. But it's this dedication to the greater good and some care. And I think over the years, in a system that favors liability and market forces, it's maybe felt increasingly difficult to take an active stand. And yet, our voices are really powerful. We see the evidence of this on a daily basis. And I think we have a humanitarian obligation. And it's pretty incredible, having lived here in the DC area, how much personal connections can matter and how much power voices can have when you directly confront and contact legislators and policymakers. And so I think it's easy to have these, well, I shouldn't say easy, but I think we can have these academic discussions when we're sort of in the environment where that's encouraged. But that gets very different when we actually, head into the halls of power and when we actually get to talking to people who are doing the work. And it gets a lot messier. And I think we have to just be pretty persistent in our advocacy that we're not going to accept the status quo, that we deserve and that countless individuals deserve something better.
Definitely. And nowadays, I think it's very clear that advocating for your patient is going to be political at times because they're so intertwined. Now, my next question is if you could explicitly state how your research relates to achieving social justice and health equity.
Yeah. When it comes to social justice, I think, as I mentioned earlier, representation matters, right? And I say this as a white male from Southwest Virginia, who has had a significant amount of privilege, despite the adversity that we all face as individuals and in our own unique lives. And yet we have to be able to look sort of beyond our immediate worlds and recognize the structural powers. And I think healthcare has been, not necessarily a tool to lift people up, but has been, for the worst parts of our history, has been a tool to continue to divide and keep groups down through structural racism. I mean, being a psychiatrist, we also have to think of our roles of institutionalization, of chemical restraint. And so, for me, it's like I look to the communities that I feel like I have come to understand, or at least been able to have interactions with, where I can make a difference. And I think we all kind of have to pick those, right? And try to advocate for those voices that get pushed aside. And so, for me, this was a chance to highlight some very obvious data and low hanging fruit, but, do so in a way that tries to encourage other physicians to do the same, to recognize and again, not accept that, oh, I'm just making my change in my patient's office and in my patient's life, but that really so much of what impacts our patients happens well beyond our office walls. And so, and I think that just a more just society is a key to health equity. Those two things cannot be disentangled.
Certainly. Thank you very much for sharing that. Now, before we wrap up this podcast, I was just wondering if you had any last comments regarding your research or anything else you'd like to share.
No, I'm just, really grateful for the opportunity to speak and share. And certainly, as I said, I am, at the end of the day, I am a clinician, but one that just has never wanted to, solely look at things from strictly a cold removal, of whether we call it academia or whatever. I think our learning is important and always moving forward in our knowledge base, but I think it has to be done with purpose, right? And working to make the world better than we left it is part of what we need to be using our voices for. So